For over 20 years, NIA has been a pioneer regionally and nationally in integrative medicine and dentistry, and now genomics. My name is Mark McClure. As founder of NIA, I want to personally introduce you to pharmacogenetic testing, which we are now requesting for all our patients at NIA. Understanding how your unique individual genetic profile interacts with your environment, with foods and herbs, as well as the drugs we take, is truly the cutting edge of health. Each of us metabolizes substances differently, and pharmacogenomics is a unique information system that matches your genetic profile with your response to medications and herbs. The advantages of this technology are profound for everybody. By determining how you personally metabolize medicine, your doctor or dentist can determine the right drug and the right dose for your best outcome. Many holistic patients avoid drugs. However, this once-in-a-lifetime test can be vital in case of an unforeseen emergency, or even to determine your unique ability to detoxify other toxins. It's just like you knowing your food allergies. You can now know what drugs will be effective for you, those that will be dangerous and must be avoided, and those to be used only with caution. Other than a small processing fee, the cost of this test with insurance and Medicare is free.
My name is Charles Gand. I'm a physician who has practiced integrative, holistic, and functional medicine for 40 years. My work entails finding the root causes of chronic medical and psychiatric disorders, and oftentimes I can help my patients find alternatives to medications. However, regardless as to how effective I am in my work, there will be times when I need to prescribe drugs for my patients, or you will need to have medications prescribed to you by another practitioner. Americans are less than 5% of the world's population, yet we consume over 50% of the world's medications and over 80% of the world's opioids used for painkillers and abused when a person suffers from addictions to heroin, OxyContin, and other drugs. Deaths due to medications prescribed at a correct dosage for the right reason and taken correctly, no errors, is at least the third leading cause of death in the United States. Severe drug reactions occur in at least 2 million Americans every year, an underreported statistic. And another sad statistic is that a significant percentage of medications, both prescribed or over-the-counter, do not work in some individuals, and they suffer through their medical or psychiatric disorders, finding no relief. These severe mortality and morbidity statistics could be largely eliminated if drugs were prescribed in accordance with a patient's genetic ability to tolerate them properly. Let me introduce you to a type of genetic testing called pharmacogenetics, or thankfully abbreviated as PGX, which can determine for you why a drug won't be effective and why a drug could seriously harm or even cause your untimely death. Also, PGX testing can get us insights into the effects of herbals and other nutritional supplements and how they affect genetic expression and our overall health. This test, which can cost thousands of dollars, is now covered by most insurance plans, even Medicare. The testing is non-invasive, a simple little mouth swab. It is extremely accurate and only needs to be done once in your life, since your genetic intolerance to certain drugs will not change. As a physician, having this information about my patients helps me sleep at night, knowing with some assurance that whatever I prescribe for them is relatively unlikely to cause harm and is more likely to actually work. For instance, even though I am nationally known for being a doctor who replenishes the natural neurotransmitters and stress hormones to get people who are trapped in the addiction cycles of prescription medicine, alcohol, tobacco, and illicit drugs, I never withdraw my patients from psychiatric medication until they're feeling a lot better and have had their brain chemistry rebuilt. While we are waiting for this to happen, I must go on prescribing such medication. With PGX, I can do that safely and effectively. I practice to heal and help my patients, not to harm them. And I believe that PGX testing is mandatory for all patients. Knowing which medications will help you or harm you is an idea whose time has come. We must stop the pain and suffering and deaths. I believe PGX testing should be a standard of care for all healthcare providers, from your doctors to your dentists, from your specialists to your naturopaths, so that you will have a better idea for the rest of your life what medications are right for you and your loved ones.
Why would a biological dentist want to have your pharmacogenetic information available? Dentists administer and prescribe drugs. This information now provides us with a way to help you avoid adverse reactions to anesthesia, pain medication, and antibiotics. Armed with your pharmacogenetic test results, your dentist can use the right drug in the right dose for the times when drugs are important. In addition, your pharmacogenetic profile is provided to all of your doctors, enabling them to prescribe the right drug at the right dose and assist in making adjustments to medications previously prescribed by other healthcare providers. Here at NAYA's Biological Dental Group, we are committed to helping you achieve and maintain optimal health. Pharmacogenetic testing is an important tool to help us provide you with the highest level of care.
Does it feel okay?
Mm-hmm.
Okay. Okay, and that'll be it.
At NAYA, we strongly feel this pharmacogenetic test is for everybody. Understanding aspects of your unique genetic profile can be instrumental in unlocking previously unknown factors for achieving your health goals with less complications. We can now use state-of-the-art pharmacogenomic testing to eliminate drug and detox misery, or even death. It's quick, it's easy, it's once in a lifetime, and it's virtually free.